Most episodes of low back pain are going to improve over time, so oftentimes self-care can alleviate the pain. Pain is more significant than that, then a primary care provider may prescribe medications or physical therapy for the pain. Oftentimes we'll even do injections for spinal pain. This is one of the things that I do. There are several injections that we do, but they generally boil down to either putting cortisone in or around the spine where pain may be emanating from, or doing something called an ablation, where we use heat to destroy little sensory nerve endings. Surgery is considered really in two situations. One is if there's significant weakness in the legs from nerve damage, or if pain is severe and it's not getting better with conservative care. Those are the times that we think about surgery for low back pain. There are also some alternative care options for low back pain, such as acupuncture or chiropractic care and massage, and those can be appropriate in different settings. Conservative care is not adequate and pain is persistent, that would be a time for an MRI. Other reasons for an MRI is if there's significant weakness in the legs associated with low back pain, or if there's any risk factors for concerning causes of low back pain, such as if there's a history of cancer or significant bone thinning. MRIs of the lumbar spine will often demonstrate abnormalities, which may or may not be causing pain. These abnormalities are typically degenerative changes of the spine, and they start to take place at the young age of 20. If you get MRIs of people who are in their 30s, over 50% of people will start to show degenerative changes in the spine. At the age of 50, that number jumps to 80% of people will show degenerative changes in the spine, and by the time you're 80, everybody has degenerative changes in the spine. So degenerative changes are very common in the spine, and they may or may not be associated with low back pain. Low back pain can get better over time, even without treatment. 50% of cases of low back pain are going to get better in a month, and 90% of low back pain will get better within 3 months. There are several specialists that will care for the spine. There are surgical specialists and non-surgical specialists. I'm a non-surgical specialist. My specialty is physical medicine and rehabilitation, or you may see an anesthesiology pain physician or an interventional radiologist. Non-surgical spine specialists primarily treat pain. So if there's pain that's not gotten better with conservative treatment options, then a provider like that may be able to do a spine intervention or a spine injection that can help with spine pain. Then you have spine surgeons. They might be orthopedic spine surgeons or neurosurgical spine surgeons, and you would see them in two instances. One would be if pain remains severe despite conservative care, or if there's notable weakness in the legs suggesting nerve damage.